So the prostate is part of the male reproductive system, and it secretes or produces components of semen, and typically it's the size of a walnut, and it's just outside the bladder. The prostate cancer is the most prevalent cancer diagnosed in males. In 2019, the estimated number of new prostate cancer diagnoses is about 170,000. And of these men, it is expected that roughly 30,000 will die of the disease. So men who are at risk for prostate cancer are generally older patients. So typically their age is over 50 years old. Other groups that has been shown to have higher risk include African American patients, as well as patients with family history of prostate cancer. The signs of prostate cancer will vary actually by the stage in which the patient presents with the disease. Where prostate cancer is typically curable, which is when the cancer is localized to prostate, actually there are no symptoms for these patients. This is why screening for prostate cancer is so important, because when the disease is curable, there are no classic symptoms associated with the disease. As prostate cancer progresses though and becomes locally advanced, local urinary symptoms will generally appear. These include blood in the urine, difficulty with urination. When prostate cancer actually metastasizes or spreads outside the prostate organ to other parts of the body, these typically will involve distant lymph nodes as well as bones. And as a result of this, patients will typically have diffuse bony pain as well as weight loss, and possibly again significant blood in the urine. To detect prostate cancer, a regularly scheduled screening is usually recommended. So this includes a visit to the primary care office where urinary symptoms will be assessed, and usually a blood-based test called a prostate-specific antigen should be tested on a regular interval. Once the PSA results come back or physical exam is found to be abnormal, then patients should undergo a prostate biopsy. As for the prevention, there are really no data that's out there that is convincing enough for us to say that this approach or that agent will decrease the risk of prostate cancer. What I do generally recommend to my patients is that living a generally healthier lifestyle will help them.